Hello and welcome dear learners on the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 1, Foundation of Healthcare Quality and Infection Control, today with the Chapter 10, we will be dealing with the discussion on Quality Tools for Continuous Improvement, Part D. We will be studying over here the entire gamut of Six Sigma. What is Six Sigma? What are the phases of Six Sigma? And what are the examples of Six Sigma in healthcare? So as you know, the healthcare industry has widely used Six Sigma as a management method to make processes more efficient and improve quality. Six Sigma has been successfully used in many areas of healthcare to improve errors rates, to process time and overall performance. Six Sigma can make healthcare processes better. It helps improve patient care by reducing cost, medical errors and waiting time. Initially, it was introduced in 1987 at Motorola by Bill Smith. Although Six Sigma, it was first designed for manufacturing. It has been proved useful in healthcare where reducing errors, cost and delays is very important. So Six Sigma can make healthcare processes better. It can be used in healthcare. It helps improve patient care by reducing the cost, medical errors and waiting time. This Six Sigma approach also helps reduce patient falls and injuries, as well as lower the number of negative medical events such as infections and so lot of other things which can be helped to be understood with the help of the Six Sigma. Sigma is a method used to improve quality by applying statistical techniques. Quality means that work for service meets the required standards. So what is to be done for this quality? Whenever the standards are not met, it leads to a defect. The quality of a product or services goes down when defect occurs. A defect simply means something that does not match the state satisfaction. So what causes a defect? The main reason is variation. Variation is the biggest problem because it leads to most quality issues. Variation comes from four major input sources: materials, machines, methods and people. Materials using the wrong medicines or supplies, machines, equipment that doesn't work properly or give inaccurate test results, methods following incorrect steps or procedures, and lastly people, the staff, the hospital staff, not having enough training or the right skills. So the materials, machines, methods and people are the four main input sources. By reducing variations in these areas, the healthcare services can prove steady, reliable and high quality results. What is the concept of Six Sigma? The name Six Sigma comes from statistics. The Greek letter sigma that stands for standard deviation, which measures how much data varies from the average. The number 6 represents a very high quality, 6 times the standard deviation. In practice, a Six Sigma process allows 3.4 defect per million chances, giving a 99.99966% of success rate. The main goal is to reduce variation and mistakes in medical and administrative processes so that the patient gets safer and more reliable care. It is more towards the patient the approach of Six Sigma. Some healthcare organization aims for a 7-6 level, which means even fewer errors and better patient satisfaction than the level of Six Sigma. The Six Sigma method helps hospitals achieve measurable cost savings and use data-based decision making to improve outcomes. It also focuses on patient needs, ensuring treatments, discharges and other services are efficient and error-free. It combines ideas for TQM, that is Total Quality Management, or continuous quality improvement CQI with a stronger focus on patient satisfaction, data and performance analysis, financial results and project management. In short, Six Sigma in healthcare is TQM plus CQI, total quality management or continuous quality improvement plus patient focus, additionally plus data based improvement, plus financial gains, plus process management. So it's an equation of taking all these things. So in short, you can say Six Sigma in healthcare is TQM plus patient focus plus database improvement plus financial gains and plus process management. Let's understand the Six Sigma process. Six Sigma process explains that if a process has 6 standard deviation between the process mean and the nearest specification limit, that might be upper or lower, the defect rate will be sigma level defect rate per million. If this is 3 sigma, the defect rate will be 66,807 defect per million. In the 6 sigma, it will be 3.4 defect per million. So you may find from 66,807 the defect level per million has reduced to 3.4. So you are working on reducing actually there. What are the different phases of Six Sigma? DMAIC. You have heard this word in the previous chapters, that is define, measure, analyze, improve and control. It's a combination of all this. The Six Sigma removing defects is an important part of every project. So Six Sigma should be taken in a form of a project. This is done through a 5-step problem solving method. So you can understand DMAIC is a 5-step problem solving method. How to define it? The hospital team and project sponsor identify a key issue. The issue can be from the hospital. The issue can be one which is affecting the hospital process, affecting the patient care or the service, and decide on the result they want to reach. So there should be an expected result over there and there should be an issue there. To assess the financial impact of the problem on the healthcare facility, such as extra cost or wasted resources. This can be one among those where you can identify and you can work on these problems. The identified patients and other stakeholders as the main customers and analyze how the current process is failing to meet the needs or expectation. They write a clear problem statement and goal statement in the project charter, outlining what needs to be improved and the outcomes they plan to achieve. Where you have to see define, measure, analyze, improve and control, which is very important. And then again you have to see this entire process in the same form. How does this DMAIC works like? Where it has to be seen in define phase tools, where you find the voice of the customer over here, where the next part is of the project charter, SIPOC diagram, where critically spoiling the dotlet tools, critical to quality, that is CTQ tree, and affinity diagram. So DMAIC tools is phased and which is very commonly used in healthcare. Now comes with the measure phase. The healthcare team measures the important steps and outcome in the process that affect the quality of patient care or hospital service. They collect the actual data on inputs like staff, equipments and medications. Outputs such as treatment, results or patient satisfaction, and any errors and issues that occur. They set a baseline to understand how well the current process is working before making the improvements. DMAIC measure phase tools. The key matrices are process sigma and process cycle efficiency. Then comes the analyze phase. The team studies the data gathered during the measure phase to understand the process better. So once you are in the measure phase and then you are understanding the process better, you are able to analyze this. They find and confirm the main reasons behind the problem by using different testing methods. The testing methods and the key tools that can be used to analyze these phase tools are cause and effect diagram, hypothesis testing, hypothesis, why analysis, flow diagram, and brainstorming. In the next step, improve phase. After finding the main reason for the issue, the healthcare team plans and applies solutions to make real improvements in patient care or hospital processes. The focus is on managing changes smoothly and making practical adjustment that helps reduce mistakes, delays and safety problems. So if you can understand, it is more about reducing the mistakes, reducing the delays and the safety problems, which ultimately will affect the patient. So the common used tools over here are change management, brainstorming, solution development, decision tree, quick changeover, Kanban, FEMA, 5S, PDCA and Kaizen. Control. If we do talk about this step, actually, this keep the improved processes in place to prevent defect and from happening again. Make the process uniform and keep an eye on it. How to do that? You have to use the control phase tools. The key tools can be standardization, control charts, flow charts, revise SCI, and education and training. So, we can see now the examples of Six Sigma in healthcare. Cutting down patient waiting time in emergency department. If it is very important to be seen that how emergency department works and the importance of the waiting time over there, you can understand how it is very important to improve the way the triage is being done and the treatment steps that are carried out and actually the processes of next level there where it can be towards the IPD or even it can be towards the ICU or sometimes you may have even to see that the patients can even be relieved. Next example is making diagnosis more accurate. The most and very important part for a physician is one on working on the diagnosis. So Six Sigma can improve it? Yes, it has. Can it make it more accurate? Yes. By following a uniform method for ordering and reviewing the medical test in order to understand what is the possible diagnosis. Lowering surgical risk and complications by using a set process for preparing patients before surgery and caring for them afterward. So surgical risk is one which is very important and the complications to understand how to reduce it. Preventing medication mistakes. One very important thing in medication mistakes to understand is that how it is prescribed, how it is dispensed, what is the time, what are the doses. So what needs to be done over here? By following clear steps of what? Prescribing, dispensing and giving medication. Raising patient satisfaction, where you find now the involvement of the patient is also being seen. By having a consistent process for communication with the patient, to understand the patient and to follow up after the treatment, where the entire involvement of the patient is being seen, where you can find there's the way actually to improve the patient satisfaction. And finally, for the administrator, reducing hospital readmissions. How it is done? By using a proper system for giving discharge instructions, making a pre-planned discharge and allowing follow-up of care, where the continuity is one towards making more patient assistance, to give a good image of the hospital, to build patient relationship, even to work on customer satisfaction. So for this chapter on Six Sigma, that Six Sigma is a quality improvement methodology. You have to take it not only on the basis of statistical analysis, but you have to see the involvement of Six Sigma as a project, which is with the efforts of the entire team. No doubt the quality improvement methodology of Six Sigma is based on statistical analysis in the project phase to reduce variation and defects. Quality means meeting specifications. Quality means any deviation from the specification creates a defect. So the deviation is one to be understood properly. And Six Sigma is rightly to point actually that how a deviation specification comes to. The main cause of the defects is variation in process inputs. Variation arises from four key inputs area. It can be through materials, it can be through machines, it can be through methods, and it can be through men, where we call it as people. So all the four M's you need to work on to see the variations, how the variation arises. Reducing these variations from materials, machines, methods, and men, you have to work on ensuring a more consistent, high quality output. Six Sigma measures how far a process deviates from its targets. What is the target? Standard deviation. If there is a deviation, you may find the sigma level. Higher Six Sigma indicates more capable, less variable process. In a 3 Sigma process, about 66,807 defects per million occur. While in Six Sigma, only 3.4 defects per million occur. So you can understand how you have to work on from different level to different level. And the indications are more capable of putting you the entire gamut of the Six Sigma philosophy. And the improvement on this will give you more specifications on reducing the defects. The specifications will point out actually how the defects are really affecting the processes. Six Sigma is more towards the process input parts, where now pointing towards the references which are to be studied for the chapter 7 to chapter 10 are listed over here. You can take help of this on creating the projects for Six Sigma in the future actually for your organization. You can take it in a part actually to understand all these processes. Thank you very much.